The Healthcare Innovation Expo is the biggest health conference in Europe. More than 10,000 delegates, 150 seminars, 250 speakers, and 130 exhibitors showcasing the best innovation in healthcare. A key theme was how GPs and patients can work together to shape change in the NHS.
GPs are the kind of navigators and gatekeepers for patients, and in lots of ways they spend a lot of time trying to navigate a system which is almost incomprehensible for some patients, and I think simplifying the system in the way we do and getting GPs to help us simplify it will make their jobs much easier.
What Will and his colleagues are doing is going out and talking much more directly to the patients, not just in a clinical perspective, but in an organisational perspective as well. So they're talking to them about, the bigger health needs, how we change the health system, how we really respond to their specific needs. So the GPs are much more in control now, and it's this changeover between the PCT taking responsibility for commissioning and giving that commissioning to the GP commissioning groups, and that's really active within the Heart of Birmingham PCT.
So using our innovation team, we've been able to improve access, improve the time management for GPs so that they can actually look at a better overview of their services to try and make more general improvements as well as changing access.
NHS Chief Executive Sir David Nicholson canvassed opinion from delegates about patients having more say in their care and how it can make a difference.
The big area for me in terms of patient control is in people with long-term conditions. One of the things that all the evidence shows is that people with long-term conditions, if they give them more control and more power, not only does their own health improve, but also you get better value for taxpayers' money. It actually costs less money if they're involved in that. So I think it's a really big area for us to focus our attention on in the future.
What we're trying to do is focus on the very best care in the UK today, and that is focusing on diabetes and looking at partnerships, how the NHS is working with patient organisations and with life science companies as well. And we've had support from NHS Diabetes, Diabetes UK, the ABPI, and we're looking at just what a huge thing diabetes is and how it can affect so many people in so many different ways.
What we're promoting today is safe use of insulin. Last year, the National Patient Safety Agency issued one of their rapid response alerts to the NHS, to health carers all over the country, saying that you must learn how to use insulin properly. And so what we developed was an e-learning course that anybody can do. It's free on the NHS Diabetes website. So people can learn about insulin, they get a certificate, they can prove to their employer that they know about safe use of insulin.
NHS Local spoke to a wide range of exhibitors from within the NHS, from the voluntary sector, as well as innovative private providers.
Through modern technologies that are relatively unobtrusive, we can help people have a higher quality of life whilst also enabling higher productivity for the clinicians.
Our website is free. It's a platform where networks, anybody networking around anything with health and social care, can build their own platform, share documents, have discussions.
We provide a very simple, easy-to-use instrument and a integrated card, a disposable card, which the user only ever has to input the sample, places this into the instrument and presses the go button, basically, and in 20 minutes this will come back and return a result.
For some, the changes taking place in the NHS are rather worrying. They feel that change can actually result in cuts.
I'm really concerned that we lose our focus on the client and the patient. I think recent surveys carried out by the NHS Confederation seem to indicate that most chief execs of health trusts, anyway, are more concerned about the cuts than they are about the change. And I think we need to reverse that, because slash and burn isn't going to produce better health and social care. Change, innovative change that puts the client patient at the centre will, but I'm worried about the cuts coming before any change.
The Expo was all about innovation, improving communication between clinicians and patients, and pushing forward healthcare by embracing new technologies that enable change.
The way we communicate with our patients and with the population needs to take a great leap forward, and using these kind of media to me is very, very important for the NHS in the future.
I'm surrounded by innovation, so it's all pretty whiz-bang, to be honest, yeah.
There's lots of fascinating ideas, new ideas for patient care, new technologies. It's very important in the NHS that we do learn how to do things better.